Okay, so for this video, we are looking at ultrasound, and specifically non-thermal ultrasound, because our patient, he's 2 days out from a lateral ankle sprain. So indications for ultrasound include tissue regeneration, increasing fibroblast activity, and just general blood to the area. Contraindications, we have things like a patient who's pregnant, who has a pacemaker, any damaged skin, any blood clotting, tumors, anything like that, okay? So here is our patient. Hello, Will.
Hi.
So yeah, we're looking at his lateral ankle. He just sprained it. So today what I want to do with you is we're gonna provide some ultrasound treatment. So basically to do that, we're using this ultrasound machine, and I'm gonna be applying some gel to this and basically just moving it around the affected area. You shouldn't feel anything with this, okay? So there shouldn't be any like pain or heat or anything like that. So if at any point in the treatment you do feel those things, just let me know. But does that sound like something you'd like to try?
Sure, let's give it a shot.
Cool. So we could lay you down here if you just want to get on your back. And then obviously we do want to check with the patient to see if he had any of those contraindications. So have you had like any ankle surgery? Do you have like a joint prosthesis in here? Do you have any like history of tumors or anything?
No.
And do you have a pacemaker?
Nope, sir.
Oh, well, you do. So for this case, he does have a pacemaker.
Oh, good catch.
Yeah. But basically it's all right because we're working at the ankle. If we were working more in the trunk or neck area, then we wouldn't be performing ultrasound. But because it's at the ankle, it is permitted. So now we could go ahead and get started with our setup with the machine. So if you want to come over here, so let's turn this machine on. Okay, so we're doing sound here. And because we're just at the ankle, it's superficial. We're gonna hit 3 megahertz. And because it's non-thermal, our cycle will be 20 seconds. Time, I mean, for the purpose of this video, 5 minutes is all right. Anywhere like from 5 to 10 minutes is usually what we would provide to the patient. And then we're gonna go with the power of 0.5. I don't wanna start the machine yet because we need the faceplate on the actual skin with our gel. So I'm gonna just apply a bit. Ooh. Apply that guy there. And just before we start the machine, we could just go ahead and spread this around a little bit. Okay, so I'm gonna start the machine here. Okay, and yeah, like I said, Will, so this, I mean, it should be comfortable. You shouldn't be feeling any heat or pain or anything like that. If you do, just let me know. And yeah, so what we want to do is just keep moving this ultrasound faceplate around. We don't want to keep it in one spot. And as far as the ERA, it's usually about 2 to 3 times the size of the faceplate is where we're going to get the most effect. So we could be doing this. Just for the purpose of the video, this is pretty good. So I'm going to go ahead and stop the machine.
Keep moving.
Huh? And then from here, I would just, clean him up a little bit and clean off the instrument, and he would be good to go. How are you feeling after that?
Oh, fine, yeah.
Okay, cool. So we are good here.